morning, everyone, and thank you for joining us for day 4 of 2025 Nursing Week's events. We'll just allow a few seconds for everybody to join and get settled, find a comfortable seat because today's session is very, very exciting, and we're very happy to be joined in. Or actually, we're very happy that Care Partners has opened the doors for us. So just a few seconds and we'll get started. Good morning, everyone, and welcome. It's my absolute pleasure to welcome each and every one of you to our Day 4 Nursing Week 2025 celebrations at Care Center. My name is Bessie Nasiopoulos. I'm a case manager and professional development lead, and very excited as today we come together with our friends at Care Partners, not just as colleagues or members of the healthcare community, but as a family united by a shared commitment to compassion, excellence, and caring, building the power of nurses to transform health. Today is a special time to honor and recognize the incredible work nurses do every single day, often behind the scenes, but always at the heart of patient care. Today's event will be focused on nurses at the center of community and home care, and we are especially honored to welcome our distinguished speakers and guests from Care Partners who have joined us today. Thank you for opening your doors to us and for taking the time to be part of the celebration. Your commitment and support makes this occasion even more meaningful. Thank you to all of you, our participants, for joining online and in person, taking time out of your busy schedules, and for all the endless work you put in every day. And a great welcome and thank you to our Care Center team for once again putting together such an amazing event and for always finding new ways to support IEN's successful registration and integration journey. But before we get started, we would like to take a minute to acknowledge our land. We acknowledge that we are gathered on the traditional territories of Indigenous peoples who are the past, present, and future caretakers of this land that we call Canada. We acknowledge that we are gathered today virtually for Care Center's 2025 Nursing Week events, with participants attending from coast to coast on the ancestral and unceded territories of First Nations, Inuit, and Métis peoples. We respect and affirm the inherent and treaty rights of all Indigenous peoples across this land. We recognize that we each have a role to play in the path to decolonization and ask you to take this moment to reflect upon and acknowledge the harms and mistakes of the past, and to consider how we can each, in our own way, move forward in a spirit of reconciliation and collaboration. Now, I would love to introduce you all to our case manager and mentoring program lead, Lourdes Vicente. I remember the day I met Lourdes a little bit better. It was along the days I was a newly registered RN, feeling defeated as I was sending applications and resumes everywhere with no luck. A story that many of you may relate to, with the grind, the silence, the rejections, the job search that seemed to go nowhere. I had updated my resume more times than I could count. I had written dozens of tailored cover letters, filled out endless applications, and sat through interviews that ended with a polite, "We've decided to go with another candidate." Sometimes I didn't even get that, just silence. Devastated and losing hope, I came back to my Care Center family. I enrolled in the Employment Strategies Workshop, where I got the opportunity to meet Lourdes in person and have her facilitate and present the course that supported IENs prepare and perfect our resumes and master our job search skills. Needless to say, after all the tips and tools Lourdes shared with me in the group, I ended up landing my first RN employment opportunity, accompanied by a nursing graduate guarantee program that shined the way for my career in Canada. That's Lourdes Vicente. She's a registered practical nurse and a certified career development practitioner. She began her journey with Care Center in 2006 as a case manager and advanced to the role of mentoring program lead in 2012. With over 15 years of experience supporting internationally educated nurses, Lourdes brings a wealth of knowledge and dedication to her role. She serves as an employer liaison and coordinates both observational and virtual mentoring placements, enabling IENs to learn from expert nurses and gain valuable exposure to the Canadian healthcare workplace. She is deeply committed to matching IENs with suitable employment opportunities and works closely with employers to support the long-term success and retention of IENs in the workforce. Passionate about empowering internationally educated professionals, she finds fulfillment in helping us achieve our nursing career goals in Ontario. Without further ado, Lourdes, the floor is yours.
Thank you, Bessie, for that lovely introduction. It's like very heartfelt there. So thank you so much. It's like amazing, like how I was able to support you. Sometimes I don't even know that the impact that we case managers provide to our IES. But thank you so much. And good morning, everyone, and happy Nursing Week. A warm hello to all of us, you joining us online, as well as those joining in person at the Care Partners office in Toronto. We are excited to have you with us and hope we can see your smiling faces, especially those of you who are at the Care Partners office. If you can just like raise your hand, just say hello so we can feel your energy and excitement. I know when we're just starting, we're just kind of like excited. We're so happy that you're there and participate in the second part of the session today. And we look forward to an enjoyable and meaningful session. And we are on day 4 of our Nursing Week celebration, a week filled with inspiration, information, and appreciation for the incredible work that nurses do every day. Before we start, I'd like to play a video greeting from the Chief Nursing Officer of Canada, Dr. Lee Chapman. She was named in 2023 as one of Maclean's top 10 healthcare innovators as one of the 50 most influential Torontonians. Dr. Lee Chapman is a leader within the field of nursing and healthcare. Lee is a registered nurse with over 20 years of experience, and over the course of her career, Lee has gained a deep understanding of nursing through her work in both frontline and clinical leadership capacities. Her professional experience spans various settings, including clinical care, education, research, professional practice, administration, policy, and advocacy. After obtaining her nursing degree, Lee completed a master's in clinical health sciences from the nursing graduate program at McMaster University. Lee then completed her doctoral work in 2019 at the Lawrence Bloomberg Faculty of Nursing at the University of Toronto. Her research provided key insights into ways in which the regulation of health professionals intersects with organizational priorities in acute care settings. As Chief Nursing Officer, Lee recognizes the important contributions of nurses at the federal level and aims to ensure the integration into decisions impacting the profession. Within her role, Lee provides strategic advice from a nursing perspective on priority policy and program areas. She plays a convening role with provincial, territorial governments, federal departments, and regulatory bodies and colleges, educators, and others on key nursing issues. Additionally, Lee represents the Government of Canada at public forums, both within and outside of Canada. Lee is committed to advancing the nursing profession in Canada to ensure equitable access to safe, quality care for all. Bessie, if you could play the video from Dr. Chapman.
This week is National Nursing Week, a time to celebrate and acknowledge nurses, the first point of contact for many people when receiving health care. Today, I'm meeting with nurses at Briere Health St. Vincent Hospital in Ottawa, which offers specialized services for patients with complex needs. As Canada's Chief Nursing Officer, I see firsthand the positive impact nurses make and how they can transform not only the health of their patients and communities, but also the healthcare system. A stronger and more sustainable healthcare system needs empowered nurses. This is why, together with the nursing community, the Nursing Retention Toolkit was developed to help support nurses, keep them in the profession, and improve their working lives. Since its release, nursing employers and health authorities across Canada are implementing various initiatives within the toolkit, like here at Briere Health, where they have incorporated it into their hospital-wide strategic plan. Visit canada.ca/nursing toolkit if you want to learn more. On behalf of the Government of Canada, thank you, nurses, for your dedication and contribution to better healthcare.
We will now move to the video greeting of the Chief Executive Officer of CNA, Dr. Valerie Gurdisa. She brings over 30 years of diverse experience across public, private, not-for-profit, and senior government roles with deep knowledge of Canada's health system. She has worked in Alberta and Ontario and served in various capacities in 11 of the 13 provinces and territories, including the federal government. She has led transformation initiatives focused on care system redesign, health and human service integration, and workforce strategies both nationally and internationally. Beginning her nursing career in 1988 at Mount Sinai Hospital in Toronto, Valerie has held roles from RN and NP to clinical educator, senior management, and chief nurse executive. Her extensive academic background includes faculty appointments at 7 Canadian universities with a focus on health and human services integration. Previously, she served as CEO at the Canadian Mental Health Association at Simcoe County Branch. Valerie is committed to optimizing the role of regulated nurses and ensuring the voices of 478,000 nurses and nursing students are heard. She is dedicated to advancing national nursing and health policy in collaboration with the board of directors, CNA members, and partners across Canada.
Hello, I am Valerie Gordista, CEO of the Canadian Nurses Association, and I am so pleased to be part of this special celebration with you. National Nursing Week takes place from May 12th to the 18th, and this year's theme, The Power of Nurses to Transform Health, is an important reminder of the vital role nurses play every day. Nurses are not only at the heart and mind of compassionate care, they're leaders, innovators, and advocates shaping the future of healthcare. A big thank you to the CARE Center for Internationally Educated Nurses for the invitation to share a few words. Your ongoing work to support internationally educated nurses is essential to building a strong, inclusive, and diverse nursing workforce in Canada. To all the IENs in Canada, your dedication, expertise, and experience are a gift to our health system. You bring so much value to our profession, and we are proud to have you as part of the Canadian nursing community and family. At CNA, we're here to support you. When you join CNA, you become a part of a national network of nurses representing more than 470,000 individuals working to advance our profession, support one another, and transform healthcare across the nation, leading the way together. On behalf of everyone at CNA, thank you for everything you do. And once again, happy National Nursing Week 2025.
Thanks so much, Bessie. And thank you for those the two video greetings that we received. And again, we have to be proud of being nurses. And again, it's amazing to celebrate it this week with all of you. So today we are delighted to continue our celebration by welcoming 5 outstanding staff members from Care Partners, including 2 who are proud members of our very own Care Center family. We're honored to have them with us as they share their invaluable experiences and perspectives on the essential role of nurses in delivering compassionate, high quality care in the community and at home. Their insights will shed light on the vital impact nurses have in making care more accessible, personal, and community centered. We look forward to an inspiring, engaging, and informative session as we highlight the theme Nurses at the Center of the Community and Home Care. If you have any questions throughout the session, please feel free to type them into our QA box and we'll do our best to answer as many as possible in real time. If we run out of time, don't worry, we'll follow up with responses via email afterward. And for those of you who are online and would like to apply at Care Partners, please contact your individual case managers later on and we will help you forward your resumes to Care Partners. Now I would like to introduce to you the first 3 speakers. We have the manager of the Strategic Partnerships and Settlement Program at Care Partners, Katie Akhtar. Katie has 23 years of education. She completed her education in electronics engineering, and at the age of 22, she moved to England to further her education, including in the education sector. During her time in England, she worked as a teacher before relocating to Canada in late 1998. In Canada, she began her journey with the Red Cross, which later became Care Partners. She started as a PSW and quickly climbed the ranks, eventually serving as a team lead, supervisor, assistant manager, and operations manager, which she served over 10 years. In 2022, she joined the Learning and Development team and started a new program, which is the Strategic Partnership and New Settlement Program. She developed a strong and solid foundation for this initiative, focusing on supporting newcomers and refugees and providing them with a strong foundation and employment opportunities. Collaborating with many great partners, Care Partners is committed to make positive impact in our community. And we also have Sarah Burns, who is the director of the Professional Practice and Integrated Care for Care Partners. She specializes in providing leadership in the home and community care sector. With over 25 years of experience in the home and community care sector, Sarah's career has extended across clinical practice, quality improvement, implementation science, and change leadership, education, and guideline development and review, patient-centered improvement, and integrated and transitional care. Sarah has led the infusion therapy program at Care Partners and provides leadership in advancing infusion therapy across home and community care. And we also have the wound care clinical specialist at Care Partner, Allison Lashen. She's a master's paired nurse with 18 years of experience working both in acute and community care. With over 10 years of wound and ostomy experience, Allison currently oversees the provincial wound care program at Care Partners. In this role, she brings strong leadership to promote best practice guidelines in wound prevention and management while building capacity among the multidisciplinary healthcare team. Now it's my pleasure to turn the time over to Katie, Sarah, and Allison. Thank you for joining us and a heartfelt welcome to all of you.
Thank you, everybody. Before I start, I would like to welcome each one of you to the Nursing Week. We are celebrating the Nursing Week, and we are honored to host this week, or the fourth day in our one of our branches, and welcome each one of you, that amazing internationally educated nurses. And also, I would like to take this opportunity to show or to appreciate the work Care Center for Internationally Educated Nurses are doing, and the support and help they are providing is absolutely amazing, and they are making the nurses ready to our healthcare system, which has a huge impact on the community. That is, let's welcome everybody, and also to celebrate the Nursing Week. And it's an honor to celebrate this week with each one of you, and all nurses. And they are doing amazing, absolutely, an impact in people's life, which none of other career can do that. And welcome, everybody. What I am going to do, I'm going to go through the history of Care Partners very briefly, and when did we start, where are we, and what services we are covering. It was started in 1984 about our founder's kitchen table, and it was only with 5 nurses. And now our founder, Linda Knight, who is RN, she recognized that is the patients, they want their services and their unique needs, and with dignity, privacy, and only the community-based home and community-based care can provide. And nowadays, we are in all 14 regions of Ontario, and Ontario Health at Home, they have 14 regions, and we are there. It means that we are providing the care in the whole province. Also, we do have a sister organization, which is internationally, we are going and providing help with in the countries they don't have adequate access to the healthcare sector. And when we look at, I'm sorry, we don't have a big screen, but here is a map of the Ontario, and we can see that the personal support work program we are covering in the whole province, and also the nursing and the therapy or clinics we are providing in majority of our areas. It's because we do not have the screen, I can tell verbally where are we. For the personal support work, we are in Champlain Southwest, central Toronto, just the PSW, but the whole province is covering or providing the PSW. For the nursing, we are in the Halton, in Hamilton, and also in the Niagara region, in Southwest region, Erie St. Clair region, Waterloo region, Central West, Central East, North Simcoe Muskoka, and Northeast. In 2023-2024, we provided 3.8 million PSW visits in the province, and 92% of our patient recommended care partners, patient or patient's family, to their friends and families. We provided 43,500 visits of therapy. And also we provided about 19,000 virtual visits, and virtual visit started during COVID time. We do have the e-home care, that is, we provided over 10,000 visits. And also for the nursing, we, with the community nursing, shift nursing, and clinic nursing, we provided almost 500,000 visits. What is home care and why it's important is home care versus hallway, I would say. As home care, we, in the home care, there is access of 24/7 access to all the healthcare professionals with the support of the latest technology. There is nursing care, home support care, physiotherapy, OT, and dietitian, speech language pathology, respiratory, and all the healthcare professionals are there, and they are involved in the healthcare, home care services. We do have the home support program. The home support program, anybody would like to put their foot at the healthcare sector work, then we do provide 1 month of paid training, and that paid training, that is, they make them ready to work almost like a PSW, with that the only difference between PSW and home support, PSW can do some of the special functions, for example, a Hoyer lift, but an HSW cannot do that. And that is, we started that, Care Partners initiated this program in 2017. And since then, we hired over 1,200 HSWs who are currently working with us. Home support, the program, the way it's designed, it is 8 days of virtual classroom, 3 days of hands-on training, gentle persuasive approach, and another 3 days of orientation, 24 hours of shadowing with a senior or experienced, I would say, experienced PSW. And that is the program we are teaching. Is the book is the PSW book, which they are teaching in the college. That has been very, very successful. And another couple of providers, they adopted that program from Care Partners. A day in a life of PSW and HSW is the PSW and HSW, they might work in the community by 1 hour, like one hour with each client, or in a shift, like probably overnight or a day shift in a retirement homes. That is, but that will is somebody with a lot of compassionate, good communication, time management, and so on. That is makes it very rewarding job. It is not the PSW job or any healthcare job, I would say, is the most secure job because it's always there. We do have a program which, when we are hiring HSW on base of the fund we receive from Ministry of Health on a yearly basis. From each region, we are putting so many, anywhere between 5 to 10 HSWs through the PSW program for free. And that is, they go to college, we adjust their schedule, we even compensate when they lose any money or any hour during that 6 months of education. But still they are working with us, for example, every other weekend or when they don't have the college schedule. That is, and then after 6-7 months, they are receiving their PSW certificate. Also, when a PSW wants to complete their RPN or RN program, still we are helping them the way that we adjust their schedule, we provide them support. We when it comes during their SPEP program or clinical placement, we accommodate that. As I mentioned, we do have in the majority of our areas, we do have the nursing program there. Then we are hiring them as a nurse. Once they complete everything, they receive their certificate. As I mentioned, we do have a global organization, CNO, and we started that in 2009. And with that, we are going every year to one of the countries who don't have the adequate healthcare sort of system there. We help them. And since we have been to quite a few countries, but since 2011, we go once or twice to Guatemala, to very remote areas. And I think that's it from me. I try to make it very brief, and if anybody has any question.
Thank you so much. And for those people, again, for IENs who are joining us online, if you have any questions, please feel free to put it in our QA box, and we'll try to answer your questions.
So first of all, thank you all so very much for having Alice and I come and speak today on professional practice and what clinical practice looks like in home and community care. My name is Sarah Burns, and I'm Director of Professional Practice and Integrated Care with Care Partners.
And I'm Allison Lashane, and I am the Clinical Nurse Specialist for Skin, Wound, and Ostomy at Care Partners.
And we're on the same team. So our team really helps guide practice. So if there's something new and innovative that's happening within healthcare, evidence-based practice, we really try to support it, to get it into our policies and procedures and our flow sheets to help guide and support nursing practice. So for today's session, and I just want to comment. So there are, I believe I was counting as folks were coming in, 23 nurses in the room together today. So thank you very much for taking the time to come out and join this. We're going to hopefully cover today, we're going to describe a little bit about home and community care. And if there's any questions, please let us know. We'll talk about Care Partners, mission and values, an overview of what home and community care is at Care Partners, identify where nursing care is delivered within the province of Ontario, and where Care Partners has contracts. We're going to outline goals for wound and infusion therapy programs. And then we hope for you to join us after, as Allison and I both have a table for some hands-on demonstrations, and feel free to, again, ask more questions. And we'll describe some of the benefits of nursing at Care Partners. So what is home and community care? And home and community care really holds a spot in my heart. That's really where I wanted to guide my career, because we're able to see patients where they live and what's impacting them, what's impacting their health, what's impacting, their day-to-day. what gives them joy, how we can help support them in delivering care. One of the definitions from Ontario Health at Home suggests that home and community care services are for people of all ages who require care in their home, at school, or in their community. So we're very flexible where we deliver care for patients. We really try to meet patients where they're at, right? So that we can help impact their outcomes so that they can have the best quality care possible. Another quote from the Government of Canada is, home and community care services help people to receive care at home rather than in a hospital or long-term care facility, and to live as independently as possible in the community. Home and community care is delivered by regulated healthcare professionals, nurses, non-regulated workers, volunteers, friends, and family caregivers. So just like Katie shared with us, our HSWs and our PSW programs, our nursing program, also allied health, it's a whole kind of well-rounded team that we try to provide that care to patients. So in terms of our mission and values, we have a few of them, and both of these slides kind of depict it, but we really are dedicated to improving the quality of life for patients. We want to see them supported with wellness and independence. Again, having patients come from hospital, many patients, and there have been surveys gone out to the community of patients, over 90% of patients want to be in their home and receiving care at home. So that really gives us an opportunity to be able to, again, go into the individual's home, provide that, plan of care, but with their input so that we're having that partnership and approach. And they have influence and direction where it makes sense, right, within that plan of care. We're driven by innovation, and you'll hear some innovative ideas towards the end of our presentation, just in terms of how we're delivering clinical care. And then we really want to partner, again, that patient partnership, that accountability, integrity, transparency, and innovation on how we're delivering that care. I have a little video here, or we have a little video here that just kind of is 1 minute, so it won't be too long, that shows what home care is about. Oh, hang on. Oh, no. Just not sure how to play it. The little boxes hiding it. Let me try. How do I? There we go. Okay. Hang on a second. Oh no. Okay. Could you hear that? Could you see that video starting on the other side? Okay. As you can tell from that video, at least I hope it was able, you could receive this message, is that Care Partners started in a very rural part of Ontario, but then grew into many urban centers. So we're within, up north in Ontario, but as well as down towards the city here. So, and really, again, in homes, apartments, condos, anywhere. Even sometimes we see patients, in hotels, depending on, what their needs are again, and help support their care. So I'm going to turn it over to Allison to and just put it back into the. Okay.
So as you saw in the video, some of the places that were being shown were areas where we deliver care within Care Partners. And I'm just going to go through those different areas and explain a little bit more of the type of care that's shown at each place. So we do majority of our visits as visiting, where we're in the patient's residence. And this includes not only nursing, but our allied health members, our personal support, and our social workers going out to meet the patients in their own residence to discuss their goals of care and treatments. We also have various clinics across the different branches where we provide it in a medical setting, very similar to a doctor's office. At this point, this is where nursing care only is provided. We also have something called Shift, which is where we're providing personalized care for patients during the entire day in their homes, but also overnight. And this could be caregiver relief, it could be PSW care, or it could be complex palliative care and taking care of them so their other loved ones can rest. This includes nursing and personal support. We also do have one transitional care unit, which is very similar to a alternative level care unit or kind of a transitional long-term care center. And this is where they provide daily care to the patients who require just a little bit of extra support as they're flowing from the acute hospital setting to their home. So they're in this place just for a little while until they gain their strength with the help of physiotherapy, nursing, and social workers to then get them stable and in their homes. We also have a very unique innovative care solution called e-home care, which is an approach to providing care in the settings with enhanced PSW, which is actually done through which provides care for an individual patient while correcting directly to a directing nurse. So this is through Teams. Yes. There are also various types of care we provide as nurses. And it's also starting with kind of the complex disease management, which then branches out from there. We also do wound care, and about 50% of our visits are actually patients with wounds. A lot of patients are now being diverted from acute care into their home settings with larger and more complex wounds, and I'll talk a little bit about that further on. We also do a lot of infusion therapies, palliative care, infection prevention and control, as well as a general post-surgical care. Evidence-based practice is our goal of care. We want to make sure that everyone across Care Partners is practicing same across all branches in a standardized way. Evidence-based practice actually involves using the best research evidence integrated with clinical expertise and the patient's values themselves to make informed decisions about their goals of care. New research is constantly being incorporated into our practice, and it helps to improve patient outcomes. At Care Partners, we really strive to make sure that every patient is being treated to the best possible scope of practice. And our team of educators, clinicianal practice specialists, such as myself, our senior leaders, we ensure that evidence-based practice is embedded in all of our policies, reflected in our documentation, and I'll show some examples of that with you in person later. And as well, we make sure that we are always educating our staff through various skill fairs, teaching aids, and in-services throughout the year. We are very proud to say that we are actually an accredited provider, and we're accredited with exemplary standing. So what that means is that we have earned the distinction of being accredited with exemplary standing from Accreditation Canada by demonstrating an unfailing commitment to providing patient-centered care. We embrace patient safety, value our staff safety and education, and the well-being and growth of continuous improvement every single day. For wound care program itself, there are a lot of goals that we seek to strive to meet. And the first is obviously patient safety and their experience. We want to achieve positive satisfaction with our wound care prevention and treatment. And by doing this, we're achieving the wound care goals, which might not always be healing. A lot of patients live with their wounds for life. So their goals of care could be more pain management, moisture management, and comfort, not necessarily actively making a wound smaller. We also want to work to reduce the risk of infection. In our clinical competencies, we want to achieve a very high skill level with all of our nurses. We want to make sure that they have a fulsome ability to complete really good holistic assessments, uphold those standards of practice, and improve clinical competencies. And of course, our outcomes. We want to make sure that we're not only healing wounds, but we're preventing wounds from developing in the first place. And this is across all care, with our PSWs, our HSWs, to our allied health. We also want to promote really good wound healing in a safe, infection-reduced, pain-reduced plan of care with the patient. And Sarah's going to speak more to our IV therapy program.
Thanks so much, Allison. And the similar type principles go for really all of our clinical programs, but we're speaking about wound care and infusion therapy today, so we thought we'd highlight some of those. And again, patient safety is our priority, and we want to make sure that we're achieving positive patient outcomes. And I'm sure that's familiar to all of you from your training, right? We look at the evidence, we identify nursing interventions that we could implement to help patients. And then we look to see, okay, what did those interventions do? How did it help our patient? Do we need to adjust something? So really, taking that, approach, thoughtful approach. We want to ensure with infusion therapy that we're reducing infection. We want to make sure that their vascular access devices are staying intact and they don't get blocked by thrombotic occlusion or a chemical type of occlusion from a medication. And we really want to try to reduce the patient having to go back to the emergency department, right? Because it can be traumatic for some patients. And yeah, just to maintain that, care at home. But we're always in, a consistent communication with the broader healthcare team. So physicians, nurse practitioners. And that's something I think that really helps be able to support the care that we're providing to our patients within. In terms of clinical competence, and I think this might be something that is of interest to you because Care Partners is very much dedicated to supporting the development of nursing clinical competence. We have strong embedded programs within our organization to, upon recruitment and hiring, we have a fulsome competency-based nursing orientation. We go through many of the skills and it's spaced out and it's spread out. So if you've never done home and community care before, it could be a little bit intimidating because there's so many skills, right, that are involved. But we really have a paced approach to orientating and developing that clinical competence for nurses that come to work for Care Partners. It goes without saying that for infusion therapy, because we're accessing the bloodstream, because there is that risk of infection, and we're administering some of the medications we're administering are really innovative lately, and we need to ensure that we're doing it in a way that is going to weigh the risks and benefits, and we're going to be able to assess our patients, assess our patients and make sure that we're able to respond to any of the complications, the signs and symptoms that they might be experiencing. And of course, we want to uphold the standards of practice. So looking to those, standards of care, the infusion nursing practice standards, the RNAO best practice guidelines, and the Canadian Vascular Access Association best practice guidelines really help to kind of guide that. And then obviously for the patient, we want to have the best outcomes we can. So looking at, is the patient getting the doses of medication that they were prescribed? Are we utilizing the vascular access device, reducing the delay in treatment, decreasing hospital visits, reducing infection, and increasing the dwell times of our vascular access devices. So what is it like being a nurse at Care Partners? We've tried to sum it up a little bit in this slide, but you are able to provide personalized care for patients in their home. So delivering that tailored care plan with input from the patient, managing medication, not mediation, medication, wound care, IV therapy, palliative care, and monitoring the health status, promoting health promotion and education. A lot of what a home care nurse does, or home and community care nurse does, is provide education to patients so that they can be as independent as possible. But we have processes in place to make sure that they're doing it safely, right? So we want to teach them, and then they have to do a return demonstration back, so that to make sure that they're, flushing the IV line correctly, or doing a dressing change correctly. Supporting patients and caregivers, offering emotional support, collaborating with other healthcare professionals, advocating for patients' needs. Again, because you're in there, in their home, or if a patient's coming into clinic, you're able to kind of have those conversations with them, so that if there's anything that's that's flagging, hey, you know what, they might need support for this, we can connect with Ontario Health at Home, with the care coordinators, and identify other services that they might benefit from to be able to promote care. And then continuous innovation. So we have a couple programs that we're starting with virtual care for wound care. So it involves specialized wound care nurses that are kind of virtually remote, providing assessment and care management. We have ultrasound guidance to place peripheral IV catheters, which is really in line with the evidence that's come out within the standards and best practice guidelines. So we're really trying to, or we do strive to stay kind of at the forefront of that innovation and ensure that all of our practices are based on the most recent evidence. So here's just a little slide. If there's any interest, you can go to our website in terms of, employment for care partners. So thank you so much.
Thank you very much.
Thank you very much, Katie, Sarah, and Allison. Thank you for sharing your information, and we're getting a lot of questions from our IENs. We're excited to hopefully be part of Care Partners. And I remember my own experience working in the community as a PSW while I was in a nursing school. It was an amazing experience as you can learn a lot of different important relevant skills, being independent, and as well as building relationship with the clients that you see every other day or within the week. It's just amazing how you build connections with them. And I know, and we know, community nursing is so important and essential to a well-functioning healthcare system because it improves access to healthcare, promotes health and prevents diseases, and reduce hospital admissions, support aging in place. And that's what we say as an immigrant. I want my parents to be at home. I'm not quite sure if I want them to be in a long-term care at this moment, but I want to keep them at home. So this is something that is like really new for us, a lot of immigrants, that we have this opportunity to support the community in the community, being a nurse or a PSW within the community. And also, community nursing also delivers holistic, person-centered care and strengthens communities. And we are grateful for the work that you do in our communities, and we are honored, really honored to be partnered with you through our OJS placement, job referrals for both nursing and non-nursing positions, and many more. And again, thank you so much for that one. So now because of the time, we are continuing with talking about the journey of these two individuals, and I'm excited to introduce two of our Care Center IENs who are now thriving in their roles at Care Partners. And they'll be sharing their personal nursing journeys with us today, offering valuable insight onto their own experiences and growth in community care. So we have Soyeon An, who is a past client member from she's from Korea with over 7 years of nursing experience in the CCU, NICU, and at the National Assembly of the Republic of Korea. She began her nursing journey in Canada in January of 2020 and has since made remarkable progress. Today, Soyeon An serves as a nurse manager at Care Partners, and she also supports fellow internationally educated nurses through the observational job shadowing program as an expert nurse. And this is the first time I've met her is because of the OJS. And I was so happy that I found out that she is a member of CARE. And Soyeon is not only a dedicated supporter of IENs, she is also a true IEN champion. She's always my go-to person at Care Partners when I need an expert nurse. And we also have today Gabriela Davis. She is a clinic nurse at Care Partners. Gabriela is a STARS IN client from Brazil with over 4 years of experience in acute clinical and surgical settings. Since arriving in Canada, she has been actively working on her CNO-RN application and has been a dedicated member of Care Center since July of 2023. As part of her professional development, Gabriela participated in the observational job shadowing program at Care Partners, where she had the opportunity to network and gain valuable insights into community nursing. This experience sparked her passion for the field and inspired her to pursue a career in community care. We are thrilled to share that Gabriela recently accepted a position as a clinic nurse with Care Partners in the Waterloo region, where she completed her OJS. So I'm so excited about that because I know she did two OJS placements at Care Partners, and she wanted to see, where does she fit, what kind of environment she wants, and she ended up loving Care Partners. And she said, Lourdes, let's apply. And then every time there's a position available, let's apply. And finally, she found a real place for her home in the clinic where she did her OJS. And the great thing about it, Soyeon An, it was her expert nurse. So that's how they know each other. So I'm just very thrilled to mention that like knowing the environment, and that's how she felt that it's her home and that's what she pursued. And now I'm crying. I just like felt like, so been helping Gabriella, like, like finding her spot in nursing. And now she is in with Care Partners. I know she is in great hands and she'll be supported. I know her family is also here and she's happy. They're all cheering for her. And again, congratulations, Gabriella, for this opportunity. This is a great opportunity to begin your career in Canada. So I'd like to turn the time now to Soyana and Gabriella.
Hi, everyone. Thanks for having me today. It feels so nervous and different because I received the service from PASS and Care Center previously, and my case manager was Megan and Nicholas at that time. I still use the resume that Nicholas created with me. So Care Center, I would like to say Care Center was a milestone for my new nursing career in Canada. What I like about Care Partners is that I can provide nursing care in the home where patient feels most comfortable, and they always love me. I can I can contribute to, moreover, I can contribute to building a healthier community here in Canada. Although the healthcare system here might be different than the one in your home country, but you will really love community health nursing once you start it. I know we're past 10:30, so there's only one thing I want to tell everyone, say to everyone, because I totally understand what you're going through. If you are in the program process of gaining a nursing license in Canada, I want to tell you, you can do it. It takes a lot of your time and effort. I was feeling like I was standing at the edge of the cliff before I got the license, because when I came to Canada in 2019, I had to start as a PSW. I already had a master's degree in nursing. I already had an RN license from the United States and Korea, but the CNO didn't give me the license. They told me I still had to take at least 5 more courses in Canada because I didn't go to school here. So I was like, okay, let's beat it. And then I eventually did it, and I am very happy to be in this position to support IENs, not only our patients. So if you are interested in community health nursing, please note we have open mind, very positive culture with Care Partners toward IENs. So thank you so much.
Thank you, Soyan.
Thank you so much. Lourdes, I want to thank you for bringing such an amazing speakers today and bring them all together. And I want to say, Soyan, for actually tonight being the speaker for the RNAO, Registered Nurse Association of Ontario, at 6 p.m., speaking about her experience in mentorship and mentoring IENs. Being one of the executive network officers myself, I'll be actually looking forward to tonight. And please, for everyone in the room and virtually, if you are a registered nurse or you are an IEN associate member with the RNAO, please join the INIG International Nursing Interest Group for the presentation this evening. Thank you so much. Looking forward. Thanks, everyone. Sorry to hijack this, but I wanted to thank you, Suya, as well for that. Okay.
Thanks,
Back
Rola.
to everyone. Back to you, Lourdes.
Thank you, Rola. Go ahead, Gabriella.
Hi, everyone. Thank you, Lourdes, for the introduction. As Soyan said, I also had a long run with my validation. I couldn't afford when I first came to Canada in 2015. And then I met with Lourdes with Care for Nurses, and they really helped me to start my validation process, direct how to make it easier, right, for us. And the job shadowing opportunity that I had, Soyan, in the clinic and also at the home care settings, it was a big experience for me to understand the different settings. And I fell in love with the community setting because I didn't have much back home, these kind of settings as a nurse. And it was great to see different procedures, wound care, IV therapy, and also understand how how big is the connection between the nurse and the client, right, the patient, and to build this great relationship, helping them with their independence, with their dignity, right? And I think if you're IN and you're part of the care for nurses, take the advantage of all the workshops they provide. It helps a lot. The OJS program, it's something that I can't tell more about it because it was this great opportunity for me to see these different settings as well as um, be more confident on myself as well, and the networking, right? I was able to end up and getting the job. Having I had this experience, I was able to mention during my interview as well, and I think it was a really great opportunity. I'm really thankful for Care for Nurses and also for Care Partners, right, for giving me this opportunity. Thank you.
Thank you so much, um, Soyan and Gabriela, for sharing your inspiring nursing journey with us. And thank you to Katie, Sarah, and Alison for providing valuable insights into care partners and the world of community nursing. And we hope and encourage more of the IENs that are here now will consider exploring this rewarding field. And to all our IENs, we encourage you to participate in our observational job shadowing, to experience firsthand what it's like to work in community nursing, and whether as a visiting nurse or a clinic nurse. Bessie, would you like to play a video on employment tips in getting a job? And again, thank you so much to all our speakers. We are so happy that you're here. You brought us a lot of energy and excitement, and we're hoping that you'll be receiving a lot of applications from our from our IENs. Hi there, happy Nursing Week. Are you an internationally educated nurse looking for employment? Job searching can feel like a job in itself. So here's a breakdown of practical suggestions that can help you stay focused, strategic, and successful. Suggestion number one, get clear on what you want. Define your career goal. What kind of positions are you looking for? Is it for PSW like employment, RPN, or RN? And in which setting? Is it for acute, long term care, or community nursing? It's very important that you're familiar with the responsibilities, scope of practice, and qualifications of the position you're applying for. Suggestion number two, polish your resume and prepare for job interviews. Tailor your resume for each position by highlighting relevant experience, skills, nursing knowledge, and incorporating keywords from the job description. Practice common questions aloud. Research the company well, their mission, values, culture, recent accomplishments, and be prepared to answer scenario or behavioral questions where you can highlight your nursing knowledge and skills. And participate in Care Center's Employment Strategies Workshop. Suggestion number three, apply smart, not just hard. Check out job boards such as Care Center job boards, but also company websites, and utilize referrals. Don't just mass apply, and focus on quality versus quantity. Make it a goal to send out 20 targeted resume every week. Suggestion number four, network, network, network. Reach out to people in roles you admire. Ask for 50 minutes to learn about their career path. Reconnect with old coworkers, friends, or classmates. Join professional associations like WeRPN, RNAO, and CNA. Participate in our observational job shadowing and virtual mentoring. Sign up for LinkedIn. Keep it updated, professional, and optimized with a headline that shows your value. Suggestion number five, follow up and stay organized and be resilient. Always send a thank you email after interviews. Follow up a week or two after applying if you haven't heard anything. Track your applications in a spreadsheet and celebrate small wins, such as like a callback, a good interview, even just sending out application. Remember, when job searching, Be an active care center member. Participate in employment strategies workshop where you will learn about resume writing, interview preparation, and a mock interview with a real employer. Attend Meet the Employer sessions where you will get to know employers from acute, long-term care, and community settings. Participate in observational job shadowing and virtual mentoring where you will learn about workplace culture, able to network and learn from expert nurses. Never forget to seek support from your case manager. You're not alone. We are in this together. I hope these suggestions will help you in your job search. Good luck. Watch out for tomorrow's presentations where you will hear some of our IN success stories through a panel discussion. Happy Nursing Week, everyone. So please, again, it's weird seeing myself and also another video. So please join us again tomorrow, Friday, as we welcome 3 inspiring Care Center members who will share their personal nursing journeys and successes they've achieved while pursuing their nursing careers in Canada. It promises to be an insightful and motivating session that you won't want to miss. And I'd like to take out this opportunity for us to extend our heartfelt congratulations and best wishes to Dr. Ruth Lee, who will be receiving the prestigious King Charles III Award tomorrow. This is a remarkable achievement and a true reflection of her exceptional leadership, unwavering dedication, and significant contribution to the nursing profession. We are incredibly proud and honored to celebrate this milestone with you. Congratulations again, Dr. Lee. And for now, I'll turn things over to the Care Partners staff who are leading today's in-person session at their Etobicoke location. And thank you all for joining us, and we look forward to seeing you again tomorrow on day 5 of our celebration. Unless Rola would like to say something. Go ahead.
I want to actually echo and second, actually, congratulations to our own Dr. Ruth Lee for all her support and contributions to the nursing profession and to the IENs. And I will actually steal her words and say she like encouraging IENs. Like she always say, I wasn't good enough to be an IEN because I wasn't actually accepted in a school of nursing in Hong Kong. But I would say she was more than enough to be a nurse and to be a leader and to be an IEN because she's supporting IEN, supporting the profession and leading with heart, stealing another word from our speaker, Kent Cultus, the first day. So leading with heart, Dr. Ruth Lee.
Congratulations again. And thank you everybody for joining.
Joining the ceremony. It will be noon hour tomorrow. I believe that we have sent out the link. And if you can find the link, you can go to the Canadian Nurses Association. There's 77 nurses across the country received the medal. And I'm one of the 77. I'm one of 30 in the province of Ontario. I'm truly humble. I'm truly honored. And I cannot say thank you enough to my team who is there working with me every day. And I'm happy to share my journey. I believe last fall, I have shared some of my journey with the Care Partner team. And how I remember Care Partner is that Care Center, we have a true partner in Care Partners. So very, very helpful experience. So again, if anyone's interested, you're welcome to join in the ceremony tomorrow at noon. Thank you so much.
Sir Ruth, congratulations again. And to all of you, thank you for joining, for those people online and as well as in person. And for the people in person, enjoy your session with Care Partners and happy learning and happy Nursing Week to everybody. Bessie?
Thank you, Lourdes. Thank you, Bessie. Thanks to everyone online and for the team. Maybe we can share the link to the ceremony for tomorrow through our maybe links. Bessie, you find the way we can, or maybe share it on the chat.
Everyone will receive a thank you email today with the link.
Thank you.
We'll see you all tomorrow at our session and at the celebration award, King Charles Award. So see you all tomorrow. Enjoy, those are there. To onwards and upwards, everyone.